I'm not sure I addressed the question specifically either, but I did actually want to sort of follow up on a couple of points that have been made, and specifically some of the results that Neil presented from the white paper for this particular session. Brian started in his introductory comments and later about the difficulty in assessing the efficacy of a regulatory intervention on estimating air pollutant concentrations, reductions in emissions leading to air pollutant concentrations. And some of the speakers from the first panel suggested that sort of further estimating what the effects of a specific intervention might be on, say, an exposure, not to mention a corresponding health effect, is a realm that we really need to pay much more attention to. Neil put up this interesting map that showed projected reductions in this case, sulfate, between now and 2017, and then went on to say that given the differential impact of certain regulations on sulfate concentrations, emissions and concentrations, that we could expect potentially to see differential impacts on corresponding health effects throughout the country. Where I say that a lot of our research and others in this room have found is that this is going to be very tricky, and that another challenge is really understanding the differences in several very important exposure factors that clearly, I think, are going to result in as great a change in what our exposures are to these agents as any of the geographical distribution or emissions differences as well. If you look at these areas that have been outlined in yellow, the areas that have been population weighted and that are expected to experience the greatest decreases in sulfate, and we've done a bit of work as well. I'm sorry that that bar over there is in the way. Looking at just the impact of differential infiltration on actual exposure. So these are data that are taken from a series of panel studies that were conducted over the past 10 years or so, primarily at Harvard. The studies were in Atlanta, Baltimore, Boston, and Steubenville. Incidentally, 3 of these 4 cities actually, I believe, are highlighted or circled in yellow. So these are 3, Atlanta, Baltimore, and Steubenville are projected to, according to Neil's models, to experience the greatest population-weighted reductions in exposure to sulfate. And this particular figure looks at ratios, indoor-outdoor ratios, and personal ambient ratios, specifically that I want to call your attention to sulfate. Sulfate here in this case is just a component of PM that we chose, but we can sort of think about this as perhaps being relevant to other components as well. And the data here represent ratios that were collected looking at almost 250 subjects, individuals in each of these different cities, and comprise roughly 2,000 person days of exposure and measurements. One thing, and the different symbols over here reflect whether or not we're looking at a ratio that looks at personal to ambient sulfate or indoor to outdoor sulfate. And one thing, if we just sort of focus on the at this point the empty circles here, which reflect mean personal ambient sulfate ratios across the cities and broken up by season as well. The thing that should jump out to you is that there is substantial variability in personal exposure to sulfate, or in the ratio of personal to ambient sulfate by city and even by season as well. So that in Baltimore in the winter you saw mean indoor or personal ambient ratios of about 0.5 or so, whereas you can sort of see in Boston in the summer it's almost twice that. And this is largely due to differences in infiltration in housing stock and activity patterns in each of those cities. People in Boston, when it's hot, will open their windows and they'll thus be exposed to greater concentrations of ambient PM, in this case ambient sulfate. Whereas in Atlanta, when it's hot, people close their windows, they turn on their air conditioning, and they're exposed to less of the ambient PM. So as Mike Brower sort of alluded to or mentioned specifically in the first panel, as we achieve greater reductions in ambient concentrations, some of these exposure factors and the differential expression of these exposure factors by region or by city will, I believe, become more and more important. It clearly affects what we're exposed to on a personal level, and right now it's somewhat neglected. There is initial indication, certainly over longer-term health effects, that accounting for some of these factors does explain heterogeneity and risk. Now, these differences, I believe, in a traditional epi-modeling approach may or may not be problematic. They may contribute some uncertainty. They may or may not contribute some bias to the estimates. But when we move to an accountability setting where we're looking at attributable risk or specific influences on health outcomes, numbers of health outcomes, I believe that these might be actually, these differences in these exposure factors may be more important and need to be considered. Infiltration in this case, which I think is driving the heterogeneity in these ratios, is but one of several exposure factors that I think are worth considering, including mobility patterns and how they differ in larger geographic domains, regional studies, national studies, differences in commuting mode patterns and duration of commutes, as has also been mentioned, and just general other underlying demographics that will affect one's exposure or the way that they're exposed to numerous pollutants, not just sulfate, I think will become very important when conducting these kinds of accountability studies assessing the impact of specific regulatory interventions. So that's really what I wanted to focus on just with my comments, and in the discussion, be happy to talk about some of the other questions.